100 years, if you pictured a medical lab, you'd probably see the same thing, right? A pathologist, a powerful microscope, and a tiny glass slide holding all the answers. Well, that's all changing. Right now, a quiet but profound revolution is swapping that glass for pixels, and it's set to transform diagnostics as we know it. Okay, let's dive in. And this slide really nails the scale of this shift. We're moving from the old way, one slide, one microscope, stuck in one room, to something totally different. The new way is one slide that can be on infinite screens, anywhere in the world. It's a fundamental rewrite of how we visualize and understand disease. So what is this technology at the heart of the transformation? It's called digital pathology, and it's all about turning those physical tissue samples into incredibly rich digital information. At its core, it's a simple but really powerful idea. You take a traditional histology slide, that little slice of patient tissue on glass, and instead of putting it under a microscope, you put it in a high-tech scanner. The result is a digital copy so detailed you can zoom in and analyze it on a computer screen, from pretty much anywhere. Here's how it works in 3 basic steps. First, the slide gets scanned, and that creates what's called a whole slide image, or WSI. The best way to think about it is like a gigantic, super high-res photo of the tissue. Then, that massive digital file can be pulled up on a computer, analyzed, and shared instantly with experts all over the world. So how does this process actually change things? Well, it unlocks some truly revolutionary benefits for medicine. We're going to break down 4 key advantages that are changing the game for labs and, most importantly, for patients. First up is the complete breakdown of distance. Suddenly, geography is no longer a barrier to getting a second, third, or even fourth opinion from the world's top experts. And think about what this really means. A patient in a small, rural hospital can have their complex case reviewed by a leading specialist in another country in just minutes, not the days or weeks it would take to ship the physical slide. This isn't just about convenience. It can be absolutely life-changing. The second major benefit is pure speed. By removing that physical glass slide from the day-to-day workflow, the entire diagnostic process gets a massive efficiency boost. Just think about it for a second. No more packing slides into special boxes, no more calling couriers, no more anxiously waiting for shipments to arrive. The digital file is just there. This accelerates everything, from the initial review to getting that final report back to the doctor and patient. And here's where it gets really futuristic. These incredibly detailed digital images are the perfect fuel for artificial intelligence, creating a powerful new partnership between the human expert and the machine. Now, what's crucial here is that the AI isn't making the diagnosis. It's acting as an incredibly powerful assistant. For example, an algorithm can tirelessly count thousands of cells or measure something with a precision that helps the pathologist make a more informed decision. It's all about augmenting human expertise, not replacing it. And finally, every single slide that gets scanned contributes to a massive, ever-growing archive of data, a digital library of disease that is becoming one of medicine's most valuable resources. This creates this incredible resource. Researchers can study thousands of anonymized cases at once to find new patterns. Students can learn from a huge library of real-world examples. And developers can use this data to build even smarter AI tools for the future. So we've seen the tech and the amazing benefits it brings. But what about the people at the center of all this? How is this revolution reshaping the role of the lab professional? This is such an important question, right? Whenever we talk about powerful new tech and AI, we absolutely have to ask about the impact on the human experts doing the work. And the answer is that this is so much more than just a new tool. It represents a deep cultural evolution in how a modern laboratory operates and what kind of skills are now essential. Yeah, the modern pathologist is becoming part physician, part data scientist. They need to be comfortable with these advanced imaging systems, interpreting data from AI algorithms, and collaborating digitally. The job is just evolving to be more integrated with technology than ever before. Which brings us to our conclusion. The central message of this entire shift isn't about replacing humans with machines. It's about making human experts even more powerful and effective at what they do. And this right here is the most important takeaway. It is all about empowerment. It's about giving these highly trained specialists supercharged tools to augment their skills, connect with their peers instantly, and ultimately deliver better, faster answers for patients. The lab of the future is less the collection of microscopes and more a central hub for diagnostic data, where pathology, computer science, and AI all come together to find some clarity. This whole transformation, from physical samples to integrated data, just opens up a world of possibilities. It leaves us with a final fascinating question. With this new digital foundation in place, what incredible diagnostic breakthroughs are coming next?
Like, share, and subscribe.